I decided, some of you saw me walking up here, I decided to try the healthcare system before the new one comes into being. And boy, it was already kind of screwy, but it's going to be really interesting in the next iteration. I broke my leg, and so, and it was a break where there's nothing they can do other than just gut it up, you know, and suck it up. And so I went to 3 different doctors on the day that I found out that I broke my leg. And they were talking about administration just a minute ago. I filled out 6 sets of paperwork 3 different times on that day, and it was all the same information. That's just whether you talk about cost in the system that are just out of control. Let me just tell you briefly who we are, because there's a lot of misunderstanding about who we are and what we do. Administaff is an off-site human resource department for small business. That doesn't sound like much until you realize most small businesses don't have a human resource department. But all the things that are included in that octagon are things that get done by somebody, and in many cases have to be done to comply with federal regulation. We're going to talk primarily about the piece of the octagon that deals with benefits management, because when you think about a human resource department in a large corporation, they do everything, and they also create the environment for providing quality benefits. The best way to understand what we do is to look at the before and after picture. Without Administaff, or before Administaff, the business and the owners of the business have an employment relationship with every employee in the company. And in addition to trying to manage the business and grow the business and do all that stuff, you got all these what we call regularly scheduled details of employment. I got to find a new workers' comp carrier. Somebody filed an unemployment claim. The health insurance policy is expiring, and it goes on and on and on. So what we did in the late 80s and early 90s is created a legal construct called co-employment. It's now licensed. We now have licensing, regulation, and legislation in about 35 states, and the rest of them really don't care. But what happens is this concept called co-employment is very important, because what it does is the business owner allows Administaff to enter into a second employment relationship with every employee in the business. Once we've established that legal employment relationship, now we do all the things on the left-hand side, and the business owner goes back to doing all the things on the right-hand side. And the important part about this is that, you know, we become a very significant buyer of benefits, okay? That's the bottom line. In addition to providing the payroll and doing all the other stuff and managing workers' compensation for our employees, because they all enroll in our plan through this co-employment relationship. So Gary, you and Bill and Chris, you still are, you know, you still are your own boss, so it's okay. Anyway, I want to show you now about the historical view of our medical costs at Administaff, and I want to go from the last recession, which kind of ended from a perspective of 2003, it ended in 2002, and so we've moved forward. This is our cost. We have several carriers because we have worksite employees, is what we call them, all across the country. And as you can see, in 2009, we spent a little over $700 million in health care benefits. That's just medical, dental, and vision. That doesn't include all the rest. We're not an insurance company. We don't ever want to be an insurance company, but we are a very sophisticated buyer, and that's kind of what I want to shift this discussion to you, to show you how we do what we do. When you look at these costs on a per covered employee per month basis over the years from 2003, we've got a compound annual growth rate of 5.64% in the cost. Now, that is a rather significant number when you think about what all it is that's covered and what's involved. And so that's why I want to take a minute and talk about how we compare to the rest of the world. This Kaiser Family Foundation puts out a report every year, and the last 6 years compound annual growth rate for small business is 6.01%, and for large corporations is 7.01%. The reason that small business is down to 6.01% is because of one of the comments I think John or Jim made earlier, and that is, I think it was Jim, about the number of people, small businesses that are offering insurance has fallen out of bed in the last 5 years. So that's why their compound growth rate in cost is so low. It used to be a lot higher. Very interesting how they fit together. So let me explain to you why our costs are low, because you all, as a number of you all as employers, we just thought, we'd show you how we do it. It's pretty simple. When you compare the marketplace to how our program works, it all starts with the cost of claims, and the cost of claims is the cost of claims, and it's for everybody in the marketplace, and it depends. It doesn't matter where you are. That's a big piece of the situation. In our program, we have lower administrative costs because obviously covering the number of people that we have and the technology solutions that Mike was talking about and interface with the carriers day in and day out, you actually can reduce your administrative cost, and that's a part of our program. There's never been an agent involved in our program for commissions, so we deal directly with all the carriers, so we don't have agents' commissions. And there's no underwriting. When we take on a new client, all the employees at that client enroll in our plan, and so there's no underwriting cost. And then when you look at the profit margins, because we're such a huge buyer of health insurance, obviously you're going to get some quantity discounts. And the last item is this thing called trend management. Now, the health insurance companies talk about managing trend, but because it's one of our primary direct costs, we have to invest a lot in managing the cost of that trend. So I want to take you through that real quick. It all deals primarily with this concept of plan design features. Now, the list of items on here includes everything from deductibles, co-insurance, out-of-pockets, all the different levels, hospital co-pays, et cetera, et cetera, et cetera. Every one of those components drives the cost of claims and the cost of trends in a very significant way. And so what you have to do in order to produce the kind of results that we have for our clients and worksite employees for over all these years is everybody's got to become an educated buyer of health insurance. And we, as I think we talked about last night, in the United States of America, we are pretty unsophisticated buyers. We really don't know because it's an entitlement that you sense. And with all of these, going to the doctor and you only got to pay $30 or $20 or whatever, when actually the visit was $100, And so you don't know all that, but that's what's the real behind the cost. So you've got to manage every single one of these. In addition to that, there's this thing called carrier accountability, and I've been with Administaff for 21 years of the 24 that we've been in business, and I can tell you that this is a big deal. When you have a lot of administrative people handling the payment of claims, et cetera, and all that kind of stuff, you really got to stay on the carrier to make sure they're not paying claims outside the system and they're paying the right amount. And those are all sound kind of mediocre, but those are big dollars that you can save in managing your health plan.